Dr. Bill Adams here for an exclusive special No Spin Live. We're here with Dr. Pat McGuire from St. Louis. Pat, how you doing?
I'm good.
So we brought Pat on because she's a world's expert in breast implants, particularly the whole situation around this, number one, breast implant ALCL, but the recall. Pat, there's been so much misinformation on the internet, and unfortunately, a lot of it really is, I don't think it's doing patients or anybody justice because it's just not good information. So this Allergan Recall, what is it? What do patients really need to know? Maybe you can share some of the misnomers and misinformation that you've been trying to clarify. So thanks for joining us.
Yeah, thanks, Bill. It's been a kind of a rough week for our patients with what was a surprise announcement from Allergan of a voluntary recall of their BioCell textured implants. And it's all their textured implants, both saline and gel implants, that were placed at any point in time because of an increased risk of development of breast implant-associated anaplastic large cell lymphoma. This is something we've known about for a long time. It's something that we've been educating our patients about, and we're not really sure what changed that caused the announcement without any warning to any of us or a chance to get anything out to our patients ahead of time. But the FDA has announced that there was an increase in the number of deaths from 21 to 33 in the world. And none of us have seen the data on these cases or had a chance to vet them to know what changed, that there was 12 additional cases reported just in the last month. I think what scared the patients the most was the term recall. Because it's like if your car has a recall, you have to bring it in and get that part taken out and a new one put in. But the FDA made it really clear in their announcement that they are not recommending women have their implants removed. That has not changed from previous recommendations, that women don't need anything more than observation, regular follow-up with their doctor, and sooner if there's any change. And the recall is an FDA term that just means the implants that were going to be sold, implants are on the shelves in hospitals or surgery centers or doctors' offices, had to be returned to Allergan, and no further implants could be placed into patients. But I think a lot of patients panic thinking, oh my gosh, I have to have my implants removed, and that is definitely not the case.
Yeah, that's definitely one of the biggest confusion or points of confusion is that the recall and what level recall. So it was really, I think what you're basically detailing that this is really a maneuver by Allergan and the FDA to basically remove all existing product off shelves in hospitals or in people's offices, as well as ceasing the sales of BioCell, correct?
Right, and I think it was a good decision on Allergan's part to voluntarily withdraw these implants until we have more information and we kind of sort through everything about breast implant-associated ALCL. And the highest risk is in macro-textured implants or high surface area implants, which BioCell is one of those.
Right. And so, Pat, what are you telling your patients? So now the patients obviously have a heightened sense of awareness despite the fact that I think your patients probably knew about it. My patients knew about it because we had sent letters out long ago just informing our patients about breast implant associated ALCL, even though it is rare. But what are you telling your patients now when they're coming in? What should they do? What kind of advice are you sharing with them?
Yeah, the first thing I'm telling my patients, and I'm also seeing other patients, we've been getting calls from all over the country, patients who want to be seen, at least when I've talked to some patients on the phone. The first thing is don't panic. No one needs their implants out tomorrow. It's not something that you have to do right away. I think patients should have the choice of whether or not they want to take the very low risk of developing breast implant-associated ALCL. 99.9% of patients, or even over that, will not develop, that have these implants, will not develop breast implant-associated ALCL. So the first thing is not panic. The other thing is make sure you know what implant you have. We've gotten a lot of calls from patients who are panicked. only to find out they have a smooth implant. As you and I know, there has never been a case of a purely smooth implant in breast implant associated ALCL. So we're telling our patients, we're pulling their charts, but while we're looking for them, we've had patients call from over 20 years ago. We have to get their charts out of the safe to look and see if they have the card that they were given, and look at that card and see if you had a smooth surfaced implant, that was not on the recall. If you have a Mentor or Sientra implant, that was not on this recall. So it was only Allergan BioCell, not smooth Allergan, not the microcell, which is not available in the United States at this time. Implants were not a part of this recall. The next thing to do is, when did we see you last? I like to see my patients every year or every other year sooner if they have any problems. If they have any problems, and the most common symptoms of BIA ALCL is swelling of one or both breasts, and it's usually pretty obvious. They feel a lump in their breast, rashes have been reported, but any change in the breast, we want to see them sooner than later. They haven't had any significant change, nothing is different. They should go on with their regular mammograms if they need them. They should make an appointment with us if they haven't been seen in a while. No one needs to rush and get their implants out, but we're happy to talk to them about the risk, and then about the risks of undergoing removal of their implants, because surgery is not without risk, and we don't want patients to rush in, have surgery, then have a complication, and for a procedure they may not have needed.
Yeah, those are some great points. And one of the things, the risks of surgery, everything needs to be put in context. I think, and that's what I think gets out of context when patients just, they know a little bit about what's going on, see the mainstream media, which is not doing a very good job of covering this at all. It's very alarmist. They're looking for scandal and ratings, but they're not really reporting the facts very well. But having surgery does have risks. And the other thing that's important is that, this very rare small risk of developing breast implant ALCL, the other thing to keep in mind is if you happen to be the unlucky person to get it, it's a very treatable disease. Actually, it's so treatable that we've looked at things like your chance of dying of breast implant ALCL if you're diagnosed appropriately and then you're treated appropriately, which is by having a capsulectomy. You're 100% of the patients thus far have been cured from it. And so the micromort, we've calculated that is about 0.5. And actually, if you compare just your micromort of having one general anesthetic is 10. Your micromort of having BIALCL, the diagnosis is 0.5. So you're about 20 times higher risk of death having just a general anesthetic. So having surgery, we do it all the time, but it's not without risk either. Right, and any surgery, there's a risk involved, and there's a 1 in 300,000 chance, I think that's quoted, that you could get a blood clot or have an anesthetic reaction and die from anesthesia. And, if all the women that have these textured surface implants have a surgery, there's a chance that a couple of them could die. Like 600,000 patients that probably have these BioCell implants in the United States, a couple of them could die just from having surgery. So we really need to understand the risks and the potential benefits of removing their implants now. I think if patients are really worried about it, and I've had a couple of patients who said, this is just driving me crazy, I'm so worried about this, then I think, try and calm them down and get them to think through it. But if they're really concerned, I think for those patients, removing their implants is not an unreasonable thing to do, but they have to understand that there's a risk involved. Yeah, I completely agree with that. And I know we actually were just discussing this week. So, in that subset of people that's really, it's driving their life, basically, doing implant removal. And then we both would say if they're that worried about it, then they should reduce the risk as far as they can. That would be doing a total capsulectomy or a precise capsulectomy as we talk about it. And then they can replace their implant if they want to do that with a smooth implant. And that would be the thing to do. But certainly not our recommendation for 100% of people. But I do want to ask you about one other related topic, because there's another big misnomer going around, a lot of misinformation on if you have a capsulectomy, whether it's for capsular contracture or you've had a seroma that's been tested and it's negative. There's a lot of people recommending on social media many non-medical people, but that you should always send the capsule tissue for CD30. CD30 is an immunohistochemistry test for screening that we send off when we have, say, a late seroma. But can you address that? Because I think that is something we don't have good information out to the masses about.
Yeah, I think that comes from the NCCN Guidelines for evaluation of a patient with a late seroma to work them up for ALCL is with the fluid that's aspirated, it is sent for immunohistochemistry looking for CD30. There's a couple of things that even benign seromas can have positive CD30. I think like 12% of benign seromas. So not just CD30 is not the only thing you have to have. We also have to have anaplastic cells, malignant cells present, and it has to be present in a single clone. And that's in the seroma fluid. For the capsule itself, that should be sent to the pathologist. The pathologist can look at it. If the pathologist sees abnormal cells, then the pathologist can decide from there what further testing needs to be done to further differentiate those cells. But you do not need to do a solid capsule CD30 staining just on the capsule. This needs to be evaluated by the pathologist.
I totally agree, and I think that's a very important point because that stuff's out there. There's, people. CD30 is the most common thing. People say you need to send it off for ALK. As you say, the most important thing, actually, is true for seromas too. The CD30 again is a screening tool, but the most important thing is the cytology, the pathologic and histologic, the way the cells look. And so that's the same thing for the solid tissue. The pathologist can look at the capsules and tell if there's any abnormal cells, and then the further testing can be done if needed be. So I think that hopefully we can get that message out to people that their capsules really don't need to be sent for CD30. They just need to be sent for a good pathologic evaluation.
Yeah, I actually asked that question specifically to Marshall Caden, who's like one of the world's experts on ALCL, is if there is no morphologic abnormality of the cells within a capsule, does that capsule be tested with CD30? He said in the absence of any abnormality in the cells, there is no need to do that.
Well, that's just awesome information, Pat. It's I know you've been busy the past couple weeks, but we appreciate you taking the time out to share some really great insights with the viewers, and certainly won't be the last time we talk to you because we're going to start getting more and more of this information out because I think people are in need of this type of really high level information. So thanks again, and we'll talk to you soon. If you want to see more of this, you can see it on the plasticsurgerychannel.com.